I don't know if everybody here knew about the bombing of the Boston Marathon a year or two ago. So those from other countries, there was a bombing episode that took place at the time of the Boston Marathon. And people were injured and so on. It was really quite a catastrophic event in Boston. And as a result, a lot of people developed symptoms of PTSD, and there are a lot of children who weren't necessarily at the scene, but they saw it on television, they heard about it, and so on. So a lot of children developed symptoms of PTSD. It just so happens that in one of the Boston hospitals, they had taken brain scans of a large group of unselected children, just to kind of see what brain scans were like in children. But then the person got the idea, well, let's examine the brain scans and see if changes in the brain scans are correlated with the incidence of PTSD symptoms in kids. And sure enough, when they did this correspondence, they found that there was a correspondence. And for those who are neurophysiologically inclined, the correspondence on the brain scan was that the amygdala, which is sometimes called the emotional, the processing center, I can call it the cognitive center, that the amygdala was hypersensitive to negative stimuli, and particularly, say, to angry faces. So if a child had this hypersensitivity in the brain scan, the child was more likely to get PTSD. So there's a correlation between the amygdala changes and the PTSD. So when I read about this, I thought, I bet these...
Can I just interrupt you for a second? These brain scans were done before the marathon bombing.
Done before the bombing, right. So the brain scans were done 2 or 3 years before the bombing. So they went into the archives, took the brain scans out, and then they correlated them with the bombing. So I figured, I'll bet that these investigators did not think of asking whether these children were catastrophizers. That is, that they would tend to take events and magnify them and make them into catastrophe. So mild or moderate events would be regarded by these children as catastrophic, so that they would greatly exaggerate the severity and the significance of events. And so I wrote to the person, and she wrote back, and she said, you know, I'm glad you asked that question. It just so happens we had an emotional questionnaire that we gave out at the time we had these brain scans. And sure enough, there were 4 items that had to do with catastrophic thinking, and have items such as, when an event occurs, I always think of the worst that can happen. And so there was definitely a correspondence between the incidence of the catastrophic thinking and the experience of PTSD 2 or 3 years later. So catastrophic thinking predicted PTSD. Now, what does this have to do with transdiagnostic, the whole transdiagnostic approach? Well, I talked to one of my assistants, Racham Galackley, who's here, and I said, let's do a review of the literature. I'm sure that one of the neglected features in the literature is the transdiagnostic aspect of catastrophizing, and that we believed that we would find catastrophizing in empirical studies across a wide range of disorders. And so we did look at a lot of disorders, and certainly panic and anxiety disorders, and OCD, and PTSD, chronic back pain, and even some colitis, transient or intermittent colitis. They all had questionnaires which predicted or correlated with the incidence of the particular psychological problem or disorder. And this probably goes wide beyond that. It's probably true in intense marital relations and other types of situations. So what we find is catastrophizing goes across all of these disorders. So it's a transdiagnostic event. But how does that help you in the formulation of a case? Is a case of depression also has catastrophizing? Is a case of OCD then really the same as a case of chronic colitis? Or is it the same as PTSD? And the answer is no. What we have found is a process, but you can't go by the process alone. You have to go by the content. And so a person with panic disorder will have the thought, a pain in my chest is a sign of heart attack, or I'm going to die, or I'm going to faint. So that is very specific. It's very idiosyncratic for panic. Somebody with OCD has the fear that if I get my hands dirty, I'm going to have a terrible disease, terrible skin disease. People with PTSD will also have catastrophic thoughts, such as, we also found it in people with minimal brain damage who would also had PTSD, and they would have the thought that if I'm not thinking well today, it means that my brain is deteriorating. So they always think the worst. That is kind of the process. But the important thing is the content, and it's the content you zero in on. So you could say to somebody, oh, you are a catastrophizer according to DSM-6. You are a catastrophizer. That is meaningless.